You're watching Fox 10 AZAM Weekends.
All right, welcome back. A new study suggests that decline in eyesight may predict dementia years before a diagnosis.
Really interesting stuff. So we're bringing in Dr. Emilio Justo to talk about this a little bit more for us today, give us a little more perspective on all this. First, good morning to you. So does this just mean my eyes get blurry and or is there a little bit more depth here to the kinds of vision decline and what that can predict for us?
Yes, well, good morning to both of you, Steve and Annalisa. It's a pleasure to be with you. Yes, you know, this is a subject that's not discussed enough, but certainly declines in vision can be an early indicator of dementia to come later. You know, we think of dementia just in terms of memory loss, but by the time a patient has memory loss, that dementia has been progressing for years. So when we go in to check our eyes, you know, the eyes are the pathway to the brain. It's a non-invasive way of evaluating the brain because examining the optic nerve and the retina, those are all extensions of the brain. We can evaluate the retinal nerve fiber layer, we can evaluate the optic nerve, we can check for signs of disease in the retina that can be early indicators of dementia to follow.
That is so interesting, and I'm curious, you know, we all know our eyes may lose their strength as we get older, and how do you know if it is just a part of aging or if this is something that you need to get checked out as a serious warning sign?
Right, excellent question. Well, there's a few ways to answer that. First of all, I think it's truly important that as we get older, let's say from the 40 to 50 year age, that we start getting dilated eye examinations at least every 2 years, and maybe one could argue every year. But then beyond that, after the age of 50, I would actually recommend yearly. Why? Because we want to check for things like you know, any sensory deprivation. It could be something as simple as cataracts, certainly, but also keep in mind that conditions that can affect vascularity in the eye, diabetes, high blood pressure, those sorts of conditions can ultimately result in not only diminishing eyesight, but ultimately may result in dementia. Now, there's not a one-to-one correlation, so I'm not here to tell your audience that, gee, if you have cataracts or diabetic retinopathy or hypertensive retinopathy, that they're going to get dementia. No, please, don't misunderstand that. I'm speaking in terms of risk factors. And so think of it very simplistically. Anything that affects heart health affects eye health, which in turn may affect our risk for dementia. So, you know, what are some possible things that we can do besides getting those routine eye exams? Well, we should focus on multiple things, on nutrition, for example, a Mediterranean diet high in antioxidants, in exercise, which increases vascular blood flow. One thing that's being discussed more and more, not so much in terms of dementia, but in everything, is sleep. Sleep is so critical. That's how our body, you know, restores itself. And there are studies suggesting that poor sleep can be contributing towards dementia. And of course, with sleep comes sleep apnea, right? So there are many individuals out there that have sleep apnea that's undiagnosed.
Well, Dr. Justo, that's not a fun thing to say to a couple morning reporters.
I know.
Because sleep's tough to come by for us.
Sleep's the first to go.
No, but really interesting perspective and knowledge here. Thanks for the insight and telling us a little bit more about this study. Thank you, Dr. Justo.
Thank you very much.